something which is a fad of Western countries? How relevant is this in countries like India?
Exactly. I think I was expecting you to ask that question.
Definitely, because we are focused on developing countries like India, Pakistan, Bangladesh, Sri Lanka. So what is the relevance of occupational therapy in those countries?
I think the role is, being an occupational therapist, the role is getting flourished in all these developing countries as well.
It is being established nowadays.
Course, yes.
Okay.
I would say it's like more of understanding, but now the patients and the family members, most of the other carers, they started understanding the significance of occupational therapy. So they are going to occupational therapists directly sometimes for the help and sort of services.
Okay.
So
you are saying that it is getting established a lot. Give me an example. How, for example, a person in your rural Coimbatore area, or let us say in Jaffna area in Sri Lanka, or let us say a district in Sindh in Pakistan, how do people in those areas, how do you think that occupational therapy is more relevant to them? Can you give me an example in an adult person, please?
You mean, I didn't get your questions clearly.
Okay,
are you asking about the role of OT for the people there?
Yeah.
I think it's just like the same, because it's the general core concept of what I was explaining to you about maintaining the occupational balance.
Would people in those kind of a settings, a rural or a semi-rural or a semi-urban kind of a setting, would it be relevant to them is what I'm thinking. See, for example, I know that we charge about, occupational therapists charge about, let us say 1,000 Indian rupees per an hour of session, or 500 or 700. So this is the kind of fee that we charge. Now, what would be meaningful for let us say a middle class Indian or a Pakistani or a Sri Lankan family to spend 500 rupees to 1,500 rupees per session, per hour session on an occupational therapist? Let us say 4 such sessions in a month for a patient with some mental health problems. What are the things that you think that are quite important in that kind of a setting?
I think I understand your question. What you're trying to say is about something to do with the socioeconomic status as well, whether they are affordable to get all these services. I think at the moment we are like, I'm not quite sure what is exactly happening in some of the rural areas, but there are opportunities where they have sort of NGOs, non-governmental organizations, charity organizations, but they are holding some camps for identifying the people with a low socioeconomic status. Still they can provide, for example, it was during the 2006, when I used to work in the physical health department, sort of working with the stroke patients, and we used to provide the community services like free of charge, and sometimes doing the free assessment campaigning, and giving like percentage of discount for them to come into hospitals, identify certain hospitals where they give a sort of special care for these people with a low socioeconomic status, and also using the resources within the community to provide them. For example, if I say crutches, for example, not giving highly sophisticated crutches or something, just to use something custom modified according to what is available in the community, using the bamboo stick and things like that. It starts from there now to more sophisticated and modern society. Now, as you said, the access to occupational therapists sometimes is very less compared because of the awareness, lack of awareness. People might not know what is occupational therapy is, and some of the organizations or associations of occupational therapy trying to create the awareness through the medias and through the public awareness camps, and they're trying to get more people towards that. And at the same time, some people do with a service motivation as well, because initially to start with, they provide free services, free campings. But at the same time, I'm not saying that's completely success, because still people are struggling, and sometimes they're not able to afford for the services. So that could be a
if I understand you rightly, what you are saying is that there are different ways in which the apparently costly occupational therapy services can also be available in rural semi-urban areas by cross-subsidization. like for example, the non-governmental organizations, the charities, the establishing practitioners who want to establish a practice of their own, etc., do cross-subsidize using their money and their time and give free services as well. And people who can afford, obviously, can easily take the services. So this is what you are saying. Okay. Can you tell me, I hear that occupational therapists are quite in demand in helping children. I am a general adult psychiatrist, so I am not too much oriented towards children's need of occupational therapy. Can you explain to me and to our viewers what occupational therapists can do to help children, please?
Exactly. When you take the pediatric population, I mean children, there's occupational therapy role is more flourished in India, I would say, compared to other developed countries.
Okay, so occupational therapists are more established and developing in the children to help the children rather than in adults in India. Okay.
If you go to any occupational therapist, they will be able to tell what exactly they can do for the children. For example, if I say about ASD, we call autism spectrum disorder.
Okay.
Children with autism, learning disability, delayed development, and children with behavioral issues. There are various spectrum occupational therapists really focusing on that.
Okay.
And the modality or the therapeutic agent they use completely vary from adult psychiatry to child psychiatry. This is more of like, for example, if I say a play, we use play as one of the modality because we strongly believe in that play is one of the good modality where you can enhance the development of children.
Okay.
So it explores the different areas. For example, if I take a child with autism spectrum disorder, where again, as you say, the self-care will be completely affected. The children may not be able to identify their needs. For example, if they want to go to the toilet, they won't be able to express it out. So occupational therapists work closely with that. So we use different programs like ABA. I don't know whether you heard about it.
No, I haven't heard.
We call it acquired behavioral analysis.
Okay.
Generally, it's like reinforcing the positive behavior and teaching appropriate techniques how they can express their needs. For example, if they want to use sign language or different other techniques where they can express their needs. For example, if they want to go to toilet,
okay,
and then that particular behavior will be reinforced.
Okay.
So that it works on the reinforced behavior program as well.
So, if I summarize again, what you are telling me is that there are different problems in children, mental health problems we are talking about, like autism, like Asperger syndrome, like learning disabilities, etc., where occupational therapists play a big important role in all these three domains that we talked about: activities of daily living, productive life, as well as leisurely activities. What you are saying is, for example, if a child is unable to tell his parents, child with, let us say, autism or some other problem, is unable to tell his parents that he is having to go to the bathroom for toilet, then you work with them and teach them using methods like play or using visual aids like pictures, etc., or dolls, etc., whereby you teach them that whenever they feel the pressure of having to go to the toilet, then they will need to either show that doll which is going to a potty, or whether they can show a sign like mama, dad, papa, this. And then whenever they do those behaviors, you keep on reinforcing these behaviors. And not only the children, you also teach this to parents so that they can keep on reinforcing this while you are away after you do your 1 hour of program.
Yes. I think you picked up the point, and when you said about the parents, that plays a major role. Especially, it's very difficult for an occupational therapist to work with the children if we don't have support from the parents. Very difficult.
Yes.
So we need the parents to have the good awareness about the children's kids, because generally what happens now, I think in this era we have a good awareness about parents are having good awareness about the children, but during few years back, if I take, they used to think their expectations were too high. When I talk about the autism children, they used to always say, oh, my child want to go into normal school, when it's going to happen. So they always, the expectation is like what do you say about fever? If somebody has fever and you give paracetamol, things like that, they want immediate relief.
Oh, yes.
So they don't tend to agree with all the goals, agree with the therapist. Sometimes it's more of they disagree with all the plans because they don't want somebody to tell their child they can't do this or they can't do that. So the acceptance from the family was really hard that time. But now they are working closely with the therapist. They can identify the possible goals and they can work with them together so to achieve the target. So the family, the parents play a big role in the children's rehabilitation.
So what you are saying is you not only work with children themselves, you also work with parents.
Yes.
And in the past, parents used to have fairly from their point of view, but unrealistic from our professional point of view. It is more of an emotional need, isn't it, for the parents to expect that. So in the past, people used to be very emotional and they used to have high expectations in spite of the difficulties that the child is experiencing in going through. But nowadays, because of the awareness, increased awareness and everything, you say that parents are nowadays more aware of what is realistic and what is unrealistic, and they are cooperating with occupational therapists in actually setting realistic goals for the children to try and achieve.
Yes, I think at the moment, when I take what is happening in India, we have like so many awareness camps, various programs targeting the parents and carers. They do workshops along with it's more of multidisciplinary working. If I say about special educators, psychologists, speech and language therapists, occupational therapists, teaching assistants, psychiatrists, all they work together, and also it helps us to work together with the parents to help the children rather than just we are treating a children with a problem. It's also helping to get the support from the parents because they spend more time with the children, isn't it? We give therapy for 1 hour
in a week.
Yeah, in a week or whatever. So and then if they don't get any proper follow up, it's no use. For example, if I say about sensory integration therapy or any activities we give for the children in that particular 40 minutes or 1 hour time, and then you can't, like for example, if they miss another session or something, it's not really helping them. It should be promoted that the family follow the same thing. So we have like a home program. So we will guide the parents what they can do, what are the possible things they can do for the children to change the environment. For example, for an ASD kid, the changing of environment is really good for them, like more of a stimulate, like for example, if they lack a sensory. If I go deep into the sensory, there are a lot of other things.
Okay,
so
let's not go deep into that.
So it's like helping the parents to set up a very less demanding and supporting environment for the kids for their development.
Okay, so what you are saying in simple terms again is, if for example, even if you do the therapy 1 hour a day, daily, if you do the therapy daily, but you're there only 1 hour in 24 hours. So parents have a lot of responsibility in ensuring that the child follows these skills and the rules and other things that he has or she has learned in that 1 hour through the next 23 hours in a day. So, for example, if our occupational therapists do it once in a week, that means that they have 7 into 24 minus 1 hour to put that into practice in the daily life to help the child practice that in the daily life. So that when you come for the next session, the child would have progressed a bit more in terms of gaining and actually using those skills. That's what you are saying, isn't it?
Yeah.
Okay.